Thank you very much indeed, Hilary. If you knew me a bit better, you know I can't remember any names of any time.
His age.
Well, thank you very much for inviting me to speak today. It's a real privilege to represent the research arm of the Foundation, and specifically to represent the research committee that I've been very proud to be the chairman of for the past 7 years. I had to ask Linda how long I've been the chairman of that. I thought it was 5, and she said no, it's 7. And so I get numbers wrong as well. It's been a real privilege to be part of this committee. And what I thought I would tell you today was just how it works and how important we think this is for the Foundation, and indeed for research and for prevention and making a difference to this disease. And then to tell you a little bit about perhaps 1 or 2 things that we see will be very important for the future, both for the disease and for the Foundation. Now, as chair of the Research Grants Committee, it's wonderful to be chairing a group of like-minded people who actually are at the top of the tree, and it's great to see people here today. Chris Tang, who is sitting in the audience, who is taking over as chair, Ed, Simon and Andrew, who are real masters of their field, and they give freely, they give great time and unconditional time to the Foundation. And I think on behalf, I can speak now as a trustee, I can just say thank you very much for that. Very, very much appreciated. One of the things that the Research Grants Committee really does appreciate, and when we get stuck, and we often get stuck in meetings, is go back to first principles. And the first principle is any penny that is spent by the Research Grants Committee is hard won. It's hard won by people, many of you in this room, and we really, really respect that and want to make sure that we spend it responsibly. The second thing is that we want to choose the very best science which will make a difference. And again, when we get stuck, we go back to say, what is the mission statement of the Foundation? And the mission statement, as you know, is to try and find prophylaxis and prevention for a meningitis B disease, to look at clinical aspects of the disease, disability following disease, care of families following the disease. And when we do get stuck and we go back to those 2 principles, that often helps us to unlock what are quite difficult decisions. We have been meeting once a year, and we meet following the decision of the trustees as to how much money is available for research. And the trustees look on research as being a crucial arm of the Foundation, because they know that even though it's very, very expensive and time-consuming, that's where differences can be made, in addition to the care and so on, which we all subscribe to, of course. We meet once a year in London, guided very much by Linda, who's here, and there are probably around 50 research proposals submitted to the Foundation each year, and they have to be weeded down to round about 5, and then we have to look at how much money is available and then decide how much can be spent in each of those proposals. And as if by magic, and Chris, I know, is concerned about this, as if by magic so far, the sums remarkably are almost identical to proposed spend and money going through. And Chris, it is nothing to do with me. You will find the same, I'm sure. It is some intervention from someone that enables that to happen. And as you've heard from Hilary, there's been an amazing amount of money over the years, almost £15 million, and there are currently 24 research projects which have been funded by the Foundation. A remarkable achievement, and the Research Committee is very proud to have helped in that. When a proposal is submitted, they're vetted by the team in Thornbury and then vetted by the Research Committee. And we decide if we're going to ask for a full proposal or if it really is falls outside of the remit of the committee. When a full proposal comes in, external referees are sought. So there are usually 3, sometimes 2, depending on how it's gone, and then 2 designated committee members to look at that grant with those referees' comments. So very, very stringent peer review. And the grants are then scored, and at the end of that time, we rank the grants which are going to be funded. And as I said, we normally end up very close to the amount of money to be spent each year. And that's difficult for Linda and the group to understand how to plan, because we all know about credit crunch and Lehman and so on. How can we say what the financial state is going to be in 2 years' time, let alone 3 or 1 year's time? So there's a lot of difficult prediction and juggling that goes on, but so far it has worked. And as we've heard from Hilary, really big differences have already been made as a result of the MRF work.